Hello, my name is Kelsey Ott-Sudik, and I'm a licensed clinical social worker with the University of Pittsburgh School of Social Work. Prior to my time at Pitt, I worked with MedOptions and then MediTelecare to provide therapy to residents in skilled nursing facilities. Today, we are going to talk about the Clinical System Review for Behavior Management Guidelines. I will refer throughout this presentation to the Behavior Management Flowchart as well as the Behavior Management Checklist. What you are seeing is the first half of the behavior management flowchart. We are going to assess the patient. This means that upon admission, we are going to review hospital transfer sheets, past orders, or other discharge information about the resident's history of or risk factors for behavior or mood symptoms. The nurse will complete the admission-readmission evaluation form in PCC. As you can see, if the resident's diagnosis includes a mental disorder or psychosocial adjustment difficulty, the licensed nurse will alert social services to assist to ensure the resident's behavioral health needs are being considered when working with this resident. If the resident does not have a history of behaviors, we will monitor for change in condition as well as notify the MD and initiate resident-specific interventions in their care plan. If they are coming to the facility without a diagnosis or history, a complete baseline care plan will be done. Let's say we have a resident that enters the facility without any mental health diagnoses but begins to display episodes of tearfulness, lack of appetite, and isolation. Then we would notify social services as well as the MD and revise the care plan to ensure we are monitoring and addressing the resident's concerns and implementing interventions to improve this resident's quality of life. Licensed nursing staff can refer to the Behavior Management Guide suggested strategies, interventions, and approaches to help with interventions for current residents who exhibit new behaviors. To make it easier for reference, print and color, laminate, and have them at each nurse's station. It is important to note that a behavior is a response of an individual to communicate indirectly or directly unmet needs, discomfort, or causes that may be difficult to articulate. Behavioral or psychological symptoms of dementia describe behavioral symptoms in individuals with dementia that cannot be attributed to specific medical or psychiatric cause, which means that the appropriate assessment and treatment of underlying factors to ensure the resident is physically and mentally in as little distress as possible. When we consider gathering information, we're going to review the resident's diagnoses, hospital transfer sheets, past orders, discharge information, and speak with the family or responsible party, and if possible, the resident. The resident may not verbalize any changes to family or friends, but may be open to discussing them with staff at the skilled nursing facility. The staff should also know any history of difficulties with drug use or alcohol, as well as mood or behavior difficulties. The Social Services Director will complete Section 4 in PCC, the Social Service Assessment and History, to gather information about the resident's background, as well as information on advanced directives, family information, mental status, psychosocial adjustment factors including mood, cognition, behavior, dignity, and physical factors, coping skills, discharge planning information, and trauma-based care. The nurse will discuss recommended interventions with the resident and representatives to collaborate on the baseline care plan. If referrals are needed for behavioral health resources, this will also be discussed at this time. Please note that a resident or their representative has the right to decline services. If you don't document it, it didn't happen. You cannot justify the needs for medications, medication increases or decreases if we do not track behaviors in PCC. We need to regularly review the tracking log and notes, as well as the behavioral healthcare provider's notes. When I provided therapy in skilled nursing facilities, I was frequently asked to see specific residents and provide recommendations. Oftentimes, though, staff would not look at my notes or incorporate them in the care plans. If you are able to provide behavioral health services to your residents, utilize the expertise of these professionals by incorporating their recommendations whenever possible. Non-pharmacological approaches will be utilized to the extent possible to avoid or reduce the use of antipsychotic medications to manage behavioral symptoms. Pharmacological interventions are only used when clinically indicated or when non-pharmacological interventions continue to be ineffective. Pharmacological interventions should be specific medical indications and for a time-limited trial. When medications are prescribed for behavioral symptoms, documentation will include the rationale for use, potential underlying causes for the behavior, the approaches and interventions that we tried prior to the use of medications, risks and benefits of medications as discussed with the resident and or their family, specific target behaviors and expected outcomes, dosage, duration, monitoring efficacy and adverse consequences, and plans, if applicable, for gradual dose reduction. At times, a gradual dose reduction should not be done if symptoms are persistent or worsen when tapering. Continuing to evaluate the resident and reviewing the tracking log to determine if the resident is a danger to self or others allows the team to ensure all residents and staff are safe. When a resident displays a mood or behavior symptom that presents safety risk, interferes with care delivery, or is socially inappropriate or stressful to others, it will be discussed at morning clinical meeting. It's important to determine the root cause of the symptom and whether it is new or existing. Marks a change in the resident's condition or clinical status, such as pain or infection. Is a reaction to something outside of the resident's control, such as a quality of caregiver interaction during care, or is alterable by non-pharmacological interventions. Residents can oftentimes feel bored, depressed, lonely, anxious, or tearful. All things that can be discussed during morning meeting to identify various ideas that can be presented to the resident and or resident's family as care planning ideas to improve the resident's quality of life. Please continue to refer to the behavioral management checklist, flowchart, and guidelines. These are helpful tools to navigate residents with mental disorders or psychosocial adjustment difficulties. The Behavior Management Guide suggests strategies, interventions, and approaches allow staff to navigate specific situations and behaviors and know that they are doing things the right way.